think the reception has been very tepid to getting boosted, and there are many reasons for that. A slow start to the communication about it, a lot of questions from the scientific community. But again, like all of COVID, science changes rapidly, and in the age of Omicron, it's kind of a really important foundation of protecting the population from getting into the hospital. So to me, as a healthcare professional, it's a no-brainer, but I can also understand why people are not feeling the same way.
I oversee the clinical operations for the system. I also take care of COVID patients. I do.
The vulnerability is most pronounced in those over 65 and those who have comorbid conditions. But nevertheless, when you look at the population aggregate, the data is unmistakable. If you've gotten boosted, you're close to 90% in prevention of hospitalization. If you've just gotten 2 shots, it hovers around 65 to 70% in Omicron. That's a huge difference. And even for infection, which we think, vaccines don't work, if you've gotten boosted, particularly recently, you're about 70% protected versus 0 to 20% against just getting infection as a 2-dose series person. So that's why the CDC changed its quarantine guidance to saying, if you're 2 doses of vaccines, you're just like an unvaccinated person in having a risk of breakthrough infection. And that's because Omicron changed our calculus.
उसको पहले यहीं से लगाना ना। हाँ बिल्कुल, आपका बेटा बहू।
नहीं मैंने नहीं कहा, मैंने बोला वो वहीं पर में कि मैंने फोन कर दिया था और अपन
the booster uptake also seems to be aligned with politics, and there's a huge difference between certain states by as much as 50%, which has not been seen before in any other vaccine difference. So I think that might need to be addressed as well if you want to have everyone come on board.